You guys want to hear something absolutely insane? I'm able to generate $842 per hour of chair time when I do clear aligners. I have also gone on to teach this workflow to over 150 dentists who have collectively produced over $9 million in revenue from aligners alone. And I'm showing this to show you all that offering aligners profitably is possible. But it wasn't always like this, because when I first started, I was fumbling over myself and having the patients come in for so many appointments. And so I was always struggling to find the balance between responsibly monitoring my patients' progress in treatment and over scheduling them. However, I spent thousands of hours and I tried countless strategies, and I found out more ways on how to do this the wrong way before I figured out the perfect scheduling system to optimize patient visits and profitability with aligners. And I'm gonna save you the thousands of hours and all the battle scars, and I'm just gonna tell you how to schedule aligner patients for maximum profitability. And what you have to do is you have to use what I call the Align Pro scheduler system. And so before we dive into the actual scheduler system, I want to talk about the myths about aligner schedules. I want to talk about the origin of how we actually found the Aligner Pro scheduler system. And then we're going to go through, and I'm just going to walk you through step by step what the appointment lengths are supposed to look like and what you're supposed to do every step of the way. Now, for all of you, just remember the training that we are going to be going over today is actually applicable to all aligner brands. It does not matter which brand you use. Take this stuff and implement it. I promise you it works. So here are the common myths about scheduling for aligners, okay? A lot of people think you need to bring them in every 4 weeks. A lot of people think all appointments have to be an hour. A lot of dentists think you have to schedule each patient differently in particular ways, and it's always a guessing game. A lot of dentists think you have to have a consultation appointment before you start the treatment. So I'm gonna break down each of these for you guys further when we go through the Align Pro scheduler system, so that way you get an idea of why these aren't true. But I'm just gonna tell you right now, these are all myths. It's making it way more complicated than it needs to be, and it's simply not true. So wouldn't it be nice to have someone just walk you through exactly how to schedule patients to maximize efficiency with aligners? Now, before we dive into that, I wanna talk to you guys about the origin of the Align Pro scheduler system. How did it come about? So when I was actually in a position where I was trying to implement aligners, I wanted to make sure that I was optimizing my time to make sure that I wasn't wasting chair time, but I still wanted to provide a high level of care. And so the only problem was that I had no idea or experience in how to do this. And I knew that if I didn't find a way to figure this out, I would probably either lose hope on offering this procedure and I'd be doing a disservice to my patients. But thankfully, my mentor, Dr. Blocker, opened my eyes to the profitability of offering aligners. And so she gave me an outline of how to structure appointments, and then I was able to use that, tweak it based off of my own experiences while I was implementing it, right? It was a very fast feedback loop. And so that is how the Align Pro scheduler system was actually created. Now, wouldn't it be awesome if there was a step-by-step scheduling system that you could follow to ensure that you maximize appointments for your patients while they're in aligner treatment? So it's called the Align Pro scheduler system, and here's a breakdown of it. So let's dive into some of the math to give you guys a glimpse of the potential profits per chair time. And so each aligner case is around $5,500 with a lab bill of about $1,500. So that's around a $4,000 profit per case. And now aligner cases require fewer visits compared to traditional ortho, which allows for a more efficient use of chair time. And so you can actually run a profitable aligner practice even in a 2-op setting. So now let's break down the appointment timeline if a case needs a refinement. So the initial visit is going to be 90 minutes. Then you're going to have a 30-minute IPR or checkup appointment about 6 to 8 weeks later, followed by a 15-minute checkup appointment about 6 to 8 weeks later. Then you're going to have a final evaluation for 15 minutes, and then you're going to scan for refinement. Now, you'll have a 60-minute deliver refinement trays and add new attachments appointment, and then you're going to have a final evaluation for about 30 minutes where you're going to scan for retainers and remove attachments. And then the last appointment is going to be a 15-minute retainer delivery appointment. And so the total time is 4 hours and 15 minutes, which results in $842 per hour of chair time. So from a profitability standpoint, guys, this is a no-brainer. What other procedure are you offering in your practice for $842 per hour of chair time? With this little of a physical load on your body, the most work that you're doing is IPR, which is simply just polishing between a couple teeth. Of course, you can streamline this even more if you leverage remote monitoring. But even if you're just sticking to this schedule, you can be extremely profitable when it comes to chair time in production. There's no comparison. Aligners are profitable when done the right way. And this is the simple method that I teach docs for aligner workflow implementation inside my aligner training programs. And I provide all the resources to help support it. So if you're interested in that, be sure to check us out at Clear Aligner Advisor. This is where we have helped, like I said, over 150 dentists integrate aligners into their practice. The website is clearalineradvisor.co. We've got a bunch of free trainings as well as the paid programs. Those are Clear Aligner Blueprint and Aligner Launchpad. And I'm also on Instagram. You can check me out there, Dr. Avi. So if your team is giving you a headache about wanting to actually implement this procedure, you need to go check out this video right now. I made it just for you. It's going to go into exactly how to get your team on board to offer this procedure. I'll see you in there.